Hi, I'm Dr. Anu Mehta, and I'm back again. And this time, and this is the last video that we're speaking about what really is low blood pressure. So, we're not just talking about high blood pressure. And, the minute we speak about high blood pressure, I know of many people who've never had high blood pressure, who have low blood pressure. But then, what does that mean? When someone has low blood pressure, it means that their pressure is less than 105/65, and they often feel dizziness, black spots in front of their eyes, and they feel listless and they have less vitality. So these are the symptoms that a person has, and I know of my mom who suffered hugely with low blood pressure rather than high blood pressure. My father was suffering from high blood pressure. So what does it really mean and translate in normal lay language? It means my father was someone who constantly took pressure on himself to do certain things. My mom, on the other hand, is always been someone who would like someone to carry the responsibility rather than she carrying it. So for her, if people, she had to be connected to her family and she had to do things for her family, she had to take a back seat because she had a younger sister who was a go-getter, who would go out and do. So when my father came into her life, my father was a go-getter, going out of his way and doing things, and she would happily take a back seat and make sure that the kids are fine and everything is fine. Now, I'm not saying that if you're sitting at home, that means you're at back seat. She's also someone who didn't worry as much. She is also someone who accepted a lot just keeping quiet. She is also someone who wasn't looking at targets or anything like that, because most of her life she was all alone. She didn't have in-laws with whom she was staying. She didn't have to report to anyone. My father was a traveler, so didn't have to report to anyone per se. So she didn't have an authority that she had to abide to. Plus, she was living her life very much away from all her family, because most of her family was in Punjab and she was in Mumbai. And because she was in Mumbai, she really didn't have to worry much. I know of the time when my mom talks about when she was to give birth to my younger sister, who's 7 years apart from me, younger than me. She did suffer from high blood pressure at that time, because obviously it was a lot of pressure on her. She was at her mom's place for almost 9 months. People were asking her questions. Now she carried that in her imprint. She carried a lot of high stress in her imprint. And the minute she reached back to her house, she got settled in Mumbai. She was like, she kind of got detached because she had heard so much that, oh, this girl is only sitting at her mom's house. So she kind of got detached, and that detachment showed in her blood pressure constantly being low, and she feeling lifeless and uh, vitality feeling really low at times. It could also be because the only family that she had in Mumbai was my father, who was constantly traveling. She didn't kind of feel connected to him at that point. And so it could be the low blood pressure that she's putting on herself. Is low blood pressure wrong? Actually, to be really honest, low blood pressure is the opposite of a high blood pressure. So if anything goes to an extreme, it's not okay. But if you're in low blood pressure, it basically means you're not in stress. It basically means that you have sorted something out, or you've been through a situation where you've sorted some stress out. Now, according to WHO, the pressure of 140/90 is considered normal. Higher than this is considered high blood pressure, and lower than 105/65 is considered as low blood pressure. It could also be at times that there could be side effect of medicines. Now, it could be that a person is having, somebody like me who's constantly like my father doing things. So yes, it runs in the family of how we will do our work. My father always said, "Dil laga ke kaam karna," and I've only understood now. If I continue doing this way, I will have a heart attack because I will continue to have high blood pressure. And that's because the instructions were you must do everything from your heart. Um, Now, I remember a few days back, and I do take the medication for high blood pressure. And what's really interesting over here is that it's common that doctors tell us that you must have a medication and you can't leave it. It sometimes, they'll give it twice a day, sometimes just once a day. Now, it could be because none of us have the same blood pressure, temperature all the time in our life. None of us have it. So it could be that at that specific moment in your life, you kind of went through a situation or took a vacation and you were not having a high blood pressure. And then you pop the medication. What will then happen? Your high blood pressure will jump and become the lower blood pressure, and your blood pressure can fluctuate just like the sugar levels can fluctuate. Yes, so it's something that doesn't stay stable or doesn't stay the same throughout. So medication can also have an impact of lowering the blood pressure to that extent. So you need to really monitor your blood pressure. And if you're feeling dizzy and blackness in your front of your eyes, or you're on a vacation, please monitor your blood pressure before having more medication around. People who are in the relaxed lifestyle, they often can have low blood pressure, and that's a good sign. It's not a bad sign at all. It just talks about, I'm not saying, oh, it has to be, lower than 105/65. I'm talking about they may not have as high, and they may not have 140/90. They may have much lower than that. And that's brilliant if they can have. That means they are having a great lifestyle. They are living their life very well, and they are enjoying, and they are calm, and they may be very, very serene people to be with. Somebody like my mom that I was talking about, when she went through a lot of stress. I've also found this with my dad. He was always had to be at job, and I can see that a lot of people who have high stress job and they have to particularly deliver at that time. Suddenly it can happen that that deadline gets moved off, or you did everything very well. And like I've mentioned before, you've gone on a holiday and the stress dissolves. And then your stress is dissolved, and so your blood pressure falls below a certain level and you're feeling dizzy. Basically, what will you do when you're feeling dizzy? You will lie down. What's your body saying? You need to rest. So the best is listen to your body as to what it is saying. We also looked at, so when we are looking at all these factors which could have an impact, we also spoke about the thyroid, and we also spoke about the heart muscle. Now, it could be that, after being, how we spoke before, that there was hyperfunction happening, too much of function happening. Now, when too much of function was happening, we were like a juggler. Now, suddenly it could be that the functioning that's required is less. And this means that we are jumping between high functioning, low functioning, high functioning, low functioning. And this could then make you feel, and how do you know that's happening? You might feel as if your heart is beating in your mouth in a repair phase, and this can create crisis around the heart muscle and can then lower your blood pressure. So very simple. If the heart muscle is in hyperfunction, you may have high blood pressure. If the heart muscle is in hypofunction, that is lowering function, you will have low blood pressure, and your body is trying to repair itself or trying to heal itself. Hypofunctioning. So again, over here, if we go back, adrenal cortex, when it was functioning extra, that is the time when you had high blood pressure. When it's functioning less, you will have low blood pressure. And when you have low blood pressure, it will be just the opposite of adrenal. When hypofunctioning was there of the adrenal glands, the person's like a power hormone, which will kick start and make you do like jig, 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 jig. You need to do everything a lot. You need to kind of really, you will go out of your way and you will have excess energy. And in the hypo, just the opposite will happen. When you have reduced amount of functioning of the adrenal cortex, you will have a reduced amount of cortisol getting secreted. Basically, the body will feel fatigued, nausea, and the best thing, as I said before, is to just rest. So basically, rest, whether it's a high blood pressure or low blood pressure. In high blood pressure, you will not realize that you need to rest. You're literally taking medication to kind of put your down, or you're telling yourself, hey, I don't need to get drowned in all this. There is another way out. But in low blood pressure is a consequence of the blood pressure on the high side going down. So again, repeating, hyper adrenal cortex, adrenal cortex, high blood pressure. Hyper let's go back here. Hyper heart muscle, and that is the right one. Functioning and high blood pressure. The minute we have low functioning, you will have low blood pressure, and hypofunctioning of the adrenal cortex, low blood pressure. It's also found sometimes because of this, you have got brown coloration of skin is also experienced by people. So this was all from me today, and signing out, Dr. Anu Mehta, about low blood pressure. So all you need to understand is our body is a miracle and our body is beautiful. Listen to your body and know we give so much importance to the tasks. We give so much importance to what we are doing that maybe we are not just spoiling our relationship with our loved ones, but we are also spoiling our relationship with ourselves. If my father was alive today, I would have told him this: Dad, you worked all your life for your job. You did a fabulous job. You kept for me great way of looking at how I must live my life. But I wish you had given us more time. And had you given us more time, maybe we would have learned to have a better relationship with us, rather than just running behind work constantly and trying to prove what I do. So beautiful people out there, please learn to rest. Please learn to take time out for yourself, and learn to, there is no situation that is so big that it cannot be sorted out. All you need to do is sit down, rest, relax, listen to your body, sleep it out. It's not such a bad thing. Yes, that job, if it has to go, it's anyway going to go. And no matter what you do, it feels as if all your life, the work that you've done is not dependent on one day. And if it is, you need to figure out whether your life is more important, or you want to continue having a relationship with yourself. Constant hurry, constant hurry, constant hurry. Get out of this hurry and give yourself a freedom. Give yourself that love that your body and your soul really needs. So thank you very much. And thank you for listening, and we'll connect back with you again. Thank you.
Help Talks are daily health-related talks held at Health Education Library for People, Mumbai, India. For more information, visit www.healthlibrary.com. Subscribe to Help Talks channel. Be better informed about your health.